person. Again, welcome to Mike Ingram from the County Board to our Board of Health meeting. I'm glad to have you on board. Is there anything you would like to do for introductions? You want us to go around and introduce ourselves? Would that be helpful to you?
I think I know most of the people.
We can do that to everybody? Okay.
But if anybody just wants to do that for fun.
Well, I mean, it's always great, you know, so everybody knows everybody.
It's a really good time.
I'm Krista Jones, and I'm the director of the University of Illinois College of Nursing.
I'm Pride Public Health Administrator at Champaign-Urbana Public Health District and Champaign County Public Health Department.
David, please.
John Peterson, physician, recently retired, but still doing things.
Do you want to say anything?
Sure,
Mike?
yeah. Mike Ingram, former county recorder who eliminated his own position, back on the county board. Funny enough, I thought at one point my wife was going to take the dentist spot on this because she's a dentist, but then that didn't end up needing to happen, so now here I am. I don't know if we could have both served on the board at the same time or not, so.
Why couldn't you?
I don't know.
Yeah, I don't think there's a conflict.
I didn't know that.
Yeah.
She might have just inferred that there was a conflict because she didn't want to do it.
Well, just because one is designated to be dentist doesn't mean we always have openings, doesn't mean that we can have more than one dentist. So, Jody?
Oh, Jody Ellis, short timer. Last day is Friday, so it's nice to have been with all of you.
Are
Thank
we
you.
going to have as good a minute after she?
I'm guessing no.
No.
And she also put the little name tags together with the names on the back of them like you wanted. And it's very fancy.
I live to serve.
Well, you're irreplaceable, Jody, so thank you so much for everything you've done.
Thank you.
Really appreciate it. And then, Dr.
Yes, my name is Ben Hick and I'm a dentist, general dentistry. I don't think I met your wife.
She works at Eric Barton's office. She's the assistant.
Yeah. So I actually practice part-time in Gibson City. So, I don't know, I practiced in Champaign for 24 years. And I took a break and then I practiced in Gibson City. So,
I'm Dottie Pirowitz. As you know, I'm a retired family physician, retired for 10 years, as you may not know. Master's in public health, and I've been in sport for a while now.
Hey, Mike, I'm Lyndon Goodley, veterinarian, 13th day of retirement from the University of Illinois.
Well, congratulations. Well, retirement's all the way
I'll
around.
tell you what, when I retire, don't look for me to be sitting around. I'm glad y'all did it.
Well, congratulations.
Thank you.
That's fantastic.
You know, I'm not so sure yet. You congratulated me in that last meeting. I don't know if congratulations are really appropriate because the reason you're retiring is so damn old.
yeah.
Well, it's a new adventure. It's congratulations on the next adventure.
But you're already looking for your next gig, so you're.
Yeah, I am actually.
There's the. Well, I think we actually just took care of the roll call for you, Jody. So I think that we're already off to a grand start tonight. So we've done that. Next would be approval of our agenda. And I do want to make an announcement as we start to look at that. Pages 1 through 163 were placed in your packets inadvertently for a public hearing for the Champaign-Urbana Public Health District meeting instead of our Board of Health meeting. So we will not need to have a public hearing on those items. But for your information, that information is available to you, which is great because we work so collaboratively together with the health district and the health department. So it's nice to know that information anyway, but that's within your packets. But
And I would like to interject that that was on me, and I am terribly sorry for those of you who read it. So
Are you retired or you've been fired?
a little bit of both.
no, not at all, not at all, not at all. With the two different agencies, it's sometimes I know with 2 meetings back to back like that. Yeah. So we will actually be beginning below on your agenda with the quarterly meeting agenda. So to make that clarification for all of you when you make the motion to approve the agenda. So do I have a motion to approve? Moved by Mike, do I have a second? Second by Dr. Hitt. Any discussion on any of the agenda? Hearing none, all those in favor? Anyone opposed or any abstentions? Thank you. The next, we have approval of our minutes from the April 25th meeting, and those are in your packet, beginning with page 164. I would entertain a motion to approve the minutes.
I'll move.
Moved and seconded to approve the minutes. Any discussion? Corrections, changes? Hearing none,
I spoke with Jody about my name, how to spell my name. It's half right and half wrong. But then she's not the person who needs to deal with it anymore.
we will make sure that gets correct.
Yes.
I will.
Thank you. Any other comments? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you for approval of the minutes. Do we have any public participation on our agenda items? Hearing none, we'll move forward to correspondence and communication. And I'll start with Julie. Do you have anything that you would like to add?
I do. I just wanted to make sure that everyone knew that Joan Lathrop, who was the Director of Social Services here from 1976 to 2000, died on May 24th. No, not May. Yes, May 24th. In her public health shirt. One of many. But, so, anyway, I want everyone to know that. I don't know who knew her, but I know Dr. Peterson knew her certainly.
Yeah, wow.
She was an absolute marvel and champion for public health, and I know you guys were very, very
And
close.
HIV, she's why we have such great HIV services here and always have, because she started those in '85 when no one else would touch them.
Thank you. And I know we have an introduction also, if you would like to make that, introduce yourself, Lisa, and then your colleague.
Yeah, I've been here before. Lisa Killoy, Vice President of Strategy and Development for Promise Healthcare, FQHC, one of them. And I just wanted to introduce our new dental practice manager, Hillary Swinford. She is a dental hygienist, and so we are super excited that she's joining us.
Thank you. Welcome. Very nice to meet you. Thank you. Anyone else have any correspondence or communication items?
I'm very sad that Jody is retiring. I just want to throw that out there.
Oh, thank you. That's kind.
Thank you, and thank you. She's done a lot of work in keeping track of a lot of the reports, you know, that are going back and forth, $50, so we appreciate that. Our next agenda item is the Smile Healthy reports and invoices. You have those in your packets. The reports are from April 2023, and we have invoices also from April 2023 totaling $6,416.66. So I would entertain a motion to approve those, and we can do those together or separately depending on your pleasure.
Motion to approve both as an omnibus motion.
Okay, motion to approve both. Seconded. Any discussion?
I'm sorry, who was the second? Oh, thank you.
Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Or any abstentions? Thank you. Next, we have approval of the CPHC invoices for March and April of 2023. For March totaling $138,897.22.
COVID grants, because I know Dr. Peterson's going to ask me.
And then April, $79,785.22. So I would entertain a motion to approve both of those invoices, or we could do those again as a separate motion if you so choose. Would you join?
Second.
Do I have a second? Moved and seconded. Any discussion of either the March or April invoices? Any questions? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. Then we have our monthly reports for communicable disease morbidity, as well as the CUPHD performance management. As you know, in the past, those get posted onto the website. And these are tallied on a monthly basis and posted up there, reviewed by the department personnel in those areas. So I would entertain a motion. We could place those on file for both, or we could do those again individually in your preference.
Motion for all of them.
Thank you. Do I have a second? Moved and seconded to place those monthly reports on file and on the website. Any discussion?
I'll just comment that I have found it useful sometimes to look at the infectious disease, communicable disease reports, just as correlation to some of the things that we discussed in those background. So it is at least sometimes worth taking the time to do it.
Excellent. Any other comments? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? That takes us to old business, an update of CUPHD's sexual health education program by Whitney Greger, who is here with us, Director of Wellness and Health Promotion.
You have one of these lovely things in your packet. I just wanted to update you guys. We are at the end of the school year, so halfway through your guys' fiscal year. We completed comprehensive sexual health education with 3 different schools. So J.W. Bader Junior High School, the 8th grade students there in Rantoul, and then the freshmen at Fisher High School and 7th graders at Fisher Junior High. So we plan to reach out to those same schools next school year, and also continue to try to make connections with Heritage, Ludlow, and Thomasboro, especially Ludlow and Thomasboro, because those kids feed into Rantoul High School. So we'd love to have all those schools on the same page with as far as their sexual health education curriculum. It's been very successful, really popular with the kids. The program we use is makes it interesting, which is important. And we have some experienced educators going up there to teach, so it's been a great success. And now we've got very similar sexual health education in the county and in the district.
Any questions for me?
I do. With all the things going on right now, I may say it wrong, LGBTQI+, whatever.
Yeah.
How does that impact your education, sex education to these kids?
I would say that it doesn't really. Our curriculum by nature is pretty inclusive of all genders. And our educators are kind of used to that within the Champaign-Urbana schools. And a lot of the Champaign-Urbana schools have GSAs, and I think that's becoming a little bit more popular in some of the county schools. We have run into problems before with other county schools that just don't want us in at all, because we do, it's too comprehensive for them, but if they don't want us in there, we don't go in there. So the ones that do accept us, they know what they're getting before we're in there teaching. They see the curriculum, they have it approved, so they kind of know what's going on. So we use gender neutral pronouns. We have, examples of same-sex couples. So it's pretty comprehensive. The kids almost never have a problem with it. It's the adults involved that usually has a percent. Yeah.
Do you have much of a problem with parents not agreeing to have their students go to the test?
No, we have a really low opt-out rate, which is.
But I can, which is even
Yeah,
better.
which they can, and then it's up to the teacher to create supplemental materials for that student to complete outside of the hours that were in there, so.
Great.
Yeah.
I know that we are concerned about where we live and things like that, but other states beginning to adapt the mentality that the parent have no say. You think that's gonna be something that approaching Illinois?
I don't think so. I really don't. I think that they have a very good, at least the schools that we interact with, they have a very good communication channel with parents. And so parents are made aware of what the children are gonna be learning, and if that's not something they want their children to learn in the classroom, they're easily opted out. And they have the supplemental stuff, like I said, that they do kind of on the side that's different than what they're learning in the classroom. But I don't think that'll happen in Illinois. I think it's.
But what could happen is that like the school board could change and then they could say they don't want us in the
Yeah.
school, and then we won't be in the school. But, it could.
It could, yeah.
I mean, because that's really up to the individual schools, but so far, we've been getting in more and more schools because they usually see the need. Usually when
Yes.
the schools see the need that they're having STDs or teen pregnancies or whatever.
So we are coming back to these schools.
Yes.
Plus working on the Heritage,
Yes.
Ludlow and Thomasboro.
Yeah, so we're definitely signed on and agreed to come back for the 3 schools that we've completed, and then we're gonna keep trying to make new connections with Heritage, Ludlow, and Thomasboro. They've had a lot of turnover, both in the principal and the teaching positions, so we're trying to make contact with them. Definitely for the Thomasboro and Ludlow kids, because they all feed into Rantoul. And at Ader, we've had really good successes referring kids for services to our Rantoul satellite office, which is like right next door to the junior high, so that's been a good partnership with us and with Wellness Health Promotion and our Teen and Adult Services Department.
So that's good.
Yeah.
Thanks.
Yep.
I will just say, I'm on the Planned Parenthood State Board, and we spent a lot of time lobbying this spring for a bill that was going to push more funding and resource availability for stuff like this. And there was nobody ever in the legislature who was like trying to push the idea of not having the parental opt-out. Like, they were all very serious about making sure that was covered in. So just if that's like a worry, they were all very serious about making sure that was. So.
Yeah, and it's kind of like when they just passed the, you can't ban books. It's like, nobody's going to make you read that book, but it still should be available to everybody else. It's like this is comprehensive sexuality education. If you want your kids to get it, as opposed to something on the internet, then they can get it. And they can see what it is too, so.
Yeah, people are welcome. There's a lot of stuff on our website about like the actual curriculum, and we're happy to like go through it page by page with people if that is interesting to anyone.
I would not want to be the sex educators in the school job, that's just.
They love it. It's
I know,
a
it's
special
just-
niche of person,
It
but
is a
they
special
love it.
thing,
Yeah.
because it just,
And the students really love that too. So.
is it because I'm a 14-year-old boy that I probably would be good?
And the feedback we get from teachers is that they also like it because they see the kids on a day-to-day basis, and so it could be kind of awkward to talk about sexual health with kids you see every day. So it's nice to have sort of a neutral third party in there.
I like that you're willing to go through it with the parents ahead of time too, because there are probably some parents that get used to this one.
Oh, absolutely.
Yeah.
That's a great point. When I was doing this years ago here, this was, I would have parents actually come in and say, can I talk to you so that I can better talk to my child? And so, yeah, that's a great point.
And I always like to use this example. When HIV first started, one of my first jobs here, it was actually on contract with the state, and I had to go around to public health departments and teach nurses sex education.
Oh, wow.
Yeah, oh wow. It was like, oh. So that was fun. But yeah, there's a lot of people that probably could use that. Because just pick up what you pick up, I guess.
That's 25 years ago.
It is. It's on 30
Longer
years
than that.
ago. Yeah. It was kind of weird. I told some of them, just leave the lights on occasionally. That'll help me out here. Just come on. At least know some anatomy. Come on. All right.
Any other questions for Wendy? Thank you very much.
Of course. Thank you guys.
I appreciate it. Our next item under other business is slate of officers and elections. So as you know, annually, we need to take a look at our officers' positions for president, chair, and vice chair, and treasurer. And I'm opening that up. That would be on 197 in your packet. Currently I serve as president, and David is vice president, and Kathy is secretary, and then members are listed there.
I will move to retain the officers in their current positions.
I'll second it.
Moved and seconded. Are you on? You're willing? You're willing? Yeah, perfectly fine with me. I'm willing to continue as well.
I have a question, has anybody spoken with Kathy and I able to find out?
Well, I actually did just have a meeting with her today at 2:30, and I asked her, I said, are you gonna be back at the meeting tonight at 5? And she said, yes. I said, okay, make sure you park on the, north side here, so I don't know.
Yeah,
That is
I was gonna congratulate her on the work that I saw that she's doing with the nursing home issue. Is that what you were meeting with her?
It is, actually, and,
I want to bring it up.
well, yeah, yeah. And that's, I guess we can do that after we get through this part, because right down there, I can tell you what we discussed.
So we can pass it in if that's an issue, then at the next meeting in August, if we need to make an adjustment in the secretarial position since she's not here, we can have that conversation at that time, if that sounds okay with you. Any other comments, questions? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. That takes us to B, under other business, discussion of request for $50,000 for the Promise Healthcare Child Dental Access Program to be submitted between January 1st, 2024 and December 31st, 2024. And then line item C, which is discussion of the request of $50,000 for Promise Healthcare to support recruitment of additional dental providers for Champaign County, again, between January 1st, 2024 and December 31st, 2024. So as you recall, last year we approved these amounts for these purposes for the program. And I think we're all interested to know how that has been ongoing and how those funds have been utilized with the additional requests this year for those funds. Just to kind of keep you informed too, Mike, we have done the $50,000 for several years now for the Child Dental Access Program. The additional $50,000 came from our surplus of funds in reserves to help support the services, and we appreciate that the county board approved that in our budget line item to support services in finding dental providers. So that was at that time a one-time expenditure to do that. So this would be an additional occurrence of that additional $50,000 expense, but that just kind of gives you what we've been looking at in the past. And so I know Lisa's here, and your call.
I don't have I'd probably like to spend more time on the second of those. Could we just go ahead and pass the first one?
Yeah, I mean, we can open up, we can
Yeah.
take them separately, open them up. I just want to introduce both of them since she's available to speak to both of them. And is there anything you want to say about the Child Dental Access Program?
Hillary's
before we do
new,
motion
so I'm
and
not
vote?
gonna throw her into this immediately, but, yeah, so we'll continue, the sealant program for our last time you funded us, that will be this fall. That is finally together. That was kind of on hiatus with COVID, but that's one when there's really a benefit where we do the rural schools outside of Champaign-Urbana. About 30%, we know that your funding is really to focus on the kids outside of Champaign-Urbana. In total, just the dental services are about 30% of the kids reside outside of Champaign-Urbana. This year and continuing into the next year, we will be emphasizing more the population around and in Rantoul and getting those kids into dental services. We will be opening at some point a school-based health center there, but it'll be a while before we implement dental. So I feel like we're making progress on the services piece. Last year, and we did put in a request this year, I think anything that you could do would be appreciated, because very sadly, there seems to be an unlimited demand for Medicaid and uninsured dental services. The calls that we get are, 3 times what we get for the rest of the clinic. So we're continuing to add. We have a total of 6 operatories that will be working. We have the funds that you gave us did allow us to do some extra bonuses because we're a small nonprofit, really, some extra bonuses to recruit more dentists, and I think it was successful. We were able, now we have 3 full-time dentists. We have 2 more coming. We have 2 public health dental hygienists. We are also, but we still have a need to recruit more because of the demand. A longtime dentist that has a facility on Kirby Street was leasing. He leased the building for 30 years or something, and he had a partner, and one person retired. So we are going to be taking over the lease of that, so we can offer more dental services. So we still have the need to recruit more dentists. I hope that it would be nice if demand would go away, but I think it's going to be a while.
The problem you have recruiting Champaign-Urbana is that folks are really focused on the larger urban areas.
It's a lot of things. It's hard to compete with private sector salaries. The population is such. So we've expanded. We're doing more restorative services than they have historically, at least for a while, done at Promise, like maybe ever, I'm not sure. So the scope of practice variety is now better, but before it was just really emergency dental. They didn't really focus on a lot of preventive, so that wasn't attractive to dentists. So we've kind of fixed that problem. It's just a variety. We do have some tools, though. We can get, dentists can get loan repayment through the National Service Corps, but it's just hard to compete, I think, with the private sector.
Do private dentists, especially in that area, but more generally, work with Give Kids a Smile Day? Is that a big deal for, I work with that.
That's what Parkland does that, right?
I'm sorry?
Parkland, the college does that. They get, I'm not sure, that's my understanding, is they get volunteer dentists. The Medicaid rate in Illinois is particularly low for dental, so I don't know. The building that in Kirby, that dentist does, he's a private dentist, but he takes a lot of Medicaid patients. It's just across the nation, private dentists just see a low percentage of Medicaid patients. For a lot of reasons, that patient population usually needs more help. They need case management. They need transportation assistance and things more so than privately insured people.
Let me tell you, as a private practice, when you provide Medicaid dentistry, you really have what you found with the government, not just being credentialed with the federal. But if you put down, or your business assistant put down the wrong code, you fraud, and they will come and take your license away. So it's a lot. My husband, when we live in Texas, he's the only one that provides Medicaid for children there. And on the Saturday that we open, if the weather's nice, you can see the boat going that way, go fishing. Okay? He had to handle every single filing to the Medicaid for reimbursement. It's really, really strict. So I'm out. He did it, but he did it, and I said I'd stay out of it because, with my business assistant, with my dental assistant, sometimes you change. Dentistry is not really black and white. Sometimes you look at an X-ray and you say, okay, I think be safe for me just to the feeling when you got there, the decay keep going, and now you have to switch on something. If they check the patient out and not correct it, and you are so stressed out, you forgot that you check at the end of the day, that's it, your license is done.
Right, my understanding of Give Kids a Smile Day was that it was something sponsored by the American Dental Association, and that people who had needed a filling, the kids only, that they would volunteer and provide free service for that one day in New York. And
They do.
so I don't think that it, I don't think that it even got into any bill. I'm aware of the Medicaid policy.
Right. For me, when I'm here in Champaign, once a year, I would have the Friday that I will do from 9 to 2 free dentistry day for children. I would have 10 kids, and that's it. Every year, just like about that month. Either because not enough publicity or not going into the school. You know, I had friends come and help me out with it, and we just like sitting around and doing nothing. And I know that Heartland Dental, they also have the free dental day on a Saturday from 8 to 2, something like that. And for everybody that needs dentistry. But many times you see it, but not that many participate.
We also try to provide the kids with a dental home is the whole emphasis. We're looking at doing some special events for the back to school dental exams that are required. But with that, we want to be able to follow up with care with the kids and stuff that we pick up. Because where the episodic care is good, the free days and stuff, that those are, anything is so helpful. But it's also the kids at the end of the day kind of need a dental home for ongoing services.
Do you find that they are consistent? They coming back every 6 months or every year?
So we have a pretty good rate of them coming back. We're working on, Medicaid only pays for one cleaning. Julie's smiling at this. But so there are ways to get them to pay for 2. There's a prior authorization. So we're working on that. With dental, everything is just so close to the margin, and we're a nonprofit, but in order to just not to break even and stuff, everything just has to work with the scheduling and everything.
Were you able to get supplies at decent price?
We do, and we are working on like donations and things for our events. We're also looking at through like a state organization. We're looking at could we get better prices through a group purchasing organization. The bigger we get, the more important. I think that if we open up additional clinics and things, that would be increasingly important for that.
So Dr. Peterson has moved forward the first of the request for the $50,000 for the Direct Child Dental Access Program, and that's on page 200 in your package. So $39,350 is allocated to dental hygienists who would be specific in recruitment and care of those in the county, and then the fringe of $10,231 for a total of $49,581, and then $419 of dental supplies for a total of $50,000. Moved and seconded. Any further discussion?
Who was the second? I'm sorry. Oh, you were the second. Who was the first?
Dr. Peterson.
Oh, sorry.
Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? And then the second request is for the $50,000 for support for recruitment of additional dental providers. That would include $13,500 for bonuses for dental providers, so for 3 potential dental providers So you had said you had hired 3 full-time based on the allotment last time, and then you have 2 more coming, and you need 1 more, so that would be the additional 3.
Mhm.
And then recruitment costs for interview and travel at $13,500, and then recruitment costs, advertising and job postings at $23,000, for the total of $50,000, and that's on page 203 of your packet. Is there a motion to approve? Okay, Kathy, is there a second? Moved and seconded. Any further discussion?
So these are phone, like side phones,
Yes,
meaning it's not a recurring number unless we
No.
decide to use them for something similar or other.
yes.
And so you were successful with last year's recruitment? What's the commitment? How long are these folks committed to staying with you?
They signed a 2-year contract.
And did they re-up this time?
They did.
They did? Are these folks getting student loan forgiveness for going into an impact area?
The new ones that are coming may, and the state is working some new programs that people might be eligible for. Ours are foreign trained dentists, so I don't know if they qualify because of the way they did their loans, but they usually, they do if they're eligible. We try to do everything that we can to get people.
Well, in medicine, and I think it's probably true with dentistry too, that is a significant recruiting factor.
Yeah. Yeah, and we're trying a new strategy too. We're trying to like talk to private sector dentists in town. You know, we have the Federal Tort Claims Act, for insurance, so you don't need to buy your own malpractice insurance, that kind of thing.
Any other comments or questions?
Just for the record, kind of a fun thing, one of your dentists in the Chicago area, she's come to the area, she's working in the area, and she's come out and golf with us at the golf club we have with you. She's a heck of a golfer.
Dr. Brito?
Did she join the
Dr.
LPI?
Coker?
I think her name is Io. Maybe it's the things in the company.
Dr. Coker, maybe?
Good.
Yes,
She was up from outside of Chicago.
yeah. It's true.
I'll have to ask.
Thank you. With no further discussion, all those in favor?
Aye.
Anyone opposed or any abstentions? And again, as a reminder, this will be coming, this additional allotment from our fund balance again, as we talked about previously.
I think we ought to include a country club membership.
That's right, yeah.
I like it, I like it.
Thank you very much.
Thank you. And Hillary, very nice to meet you.
Yeah, you too.
That takes us to other business D, approval of the subrecipient grants between Champaign County Public Health Department and Champaign-Urbana Public Health District. There's a direct grant for Illinois Department of Public Health for hepatitis C testing for $34,800 from services for July 1st through June 30th of 2024. As we had talked about it the last time we met, these will be coming through probably every time we meet now, these sub-grants. In the past, we could approve fully through the budget, now we have to approve these each individually. So as they become available, we'll need to review them and approve them.
You say that a change in state regulations?
No, it's just something that was overlooked, and the county, I don't think it's change in regulations, but Andy over at the county, there needs to be something showing that they're getting the grants, giving them to us, or we're accepting the grants. You know, there needs to be something in the public record, and there hadn't been. I mean, we were just doing it all with the budgets and whatever. So every time we get one now, we'll have it. And at the next meeting, there are 2 good things that happen. one, we're getting a workforce development grant, which, again, because we're two agencies, we get two of them, which is wonderful. And then the local health protection grant, I don't have that amount yet, but it's increasing. And so, same thing, we'll have those.
Julie, in terms of these, I mean, I was reading this after I read the first book. There's a lot of boilerplate in here. Is there some way we could avoid the boilerplate?
Well, yes, I mean, we can just do a little, like what I do
The
with the other,
first couple
just a
pages
little
here,
synopsis,
okay.
that's really all you need.
Yeah.
Yes, all of the contracts from the different agencies of the state, you know, IDPHs are all that thick and they're all the same stuff except for the first couple pages. So yes, I think that's okay. I think it just needs to be, I'll check with Tammy to make sure, but I think it just needs to show up that there is this grant and there are these two entities with this grant. So that they, I don't know, they have authority to pay it or whatever, they've always paid it.
And since we're doing things digitally now,
Yeah.
we could probably say, here's a link if you want to read the full information.
Yeah,
We could probably
yeah,
do that.
we could probably do that because you're right. And this is, which one is this with?
This was,
This is an IDPH one?
yes, yes.
And they're all really long. And I love how we have an electronic grant system now and everything is supposed to be paperless. So we do the electronic grants and we sign them electronically, then we have to print them all out and sign them again and then scan them and then mail them. So I don't understand, but it's actually more than double the work of fiddling with them. And it's called e-grams. It's supposed to be our electronic, grant management system, but that's just how it is. But yes, we can do that.
It
Just have a
involves the
little.
state of Illinois, correct?
Correct.
Yeah.
So the main thing here is that this is we have money for hepatitis C testing, which is nice. And down below that, it says, that should say CUPHD. I don't know why it says CUPPH. Not sure, but anyway. But yes, I can do that link.
Do we have a motion to approve the sub-grant?
So,
Moved by David, a second. Second by Caroline. Any further comments or discussion? Hearing none, all those in favor? Aye. Anyone opposed or any abstentions? That takes us to public participation on non-agenda items, and our public has left, so I would assume we have no additional public participation on those non-agenda
Yeah,
items.
talk about
Yeah,
that.
so then we can open up, that was just
I really
missing.
like what you, and we talked about it last month.
Yeah.
I mean, it came up as there's a need out there. So I like it.
We should. Apologies, many apologies for being so late. Sorry. There's a group of us who have started, who are concerned about our access to long-term care in this community. I printed off position papers for you, but I left them at home.
Well, I can go make a copy of it if you would like. I have it in my
Okay.
office.
What do you think? Well, it might be nice, but let me give you the background. So, there's an inventory of bed need for both hospital beds and long-term care beds that the State Department of Public Health does. And you look at the demographics, and based on that, and some other calculations they do, they project how many hospital beds you need, how many long-term care beds you need. And for our county, they say we need 721 long-term care beds. They did this last inventory in 2021. Since then, they said we needed 721, we're about 11 or 12 short of that. So we started at a little deficit. When University Rehab closes, officially I guess on the 17th, we'll lose 243 licensed beds. When Clark Lindsay, and we talked with Deborah Rubens of Clark Lindsay, when they downsized from 105 licensed beds to 49, which they'll do by the end of the year, we'll have lost a total of 299 beds. So out of the 721 we need, we'll only have 412. We'll be more than 300 beds short. We'll only have 60% of the need that we have in our county. And we went to this little group of women, and now some men, as a secret shopper who went to both the Illini Heritage, which is a small nursing home, 1 star, which is the lowest rating that you can get in Medicare, and they are full. They don't have any room. She went to CU Rehab, another 1-star facility, as low as you can get, and they have 15 beds, that's all. So Clark Lindsay has no beds available, and Clark Lindsay doesn't have Medicaid beds. Only 2 places a Medicaid patient can be is at Alina Heritage or CU Rehab. And we can't have more than 15 people who need it because that's all we have. So it's a big issue for our county, and those of us who are senior citizens know that not only for ourselves but our family members, it can be a significant issue. And there are anecdotes. We were talking about some of them today. I have a friend who just last weekend reported that his 55-year-old son, who had been discharged from Carl, had to go to Indianapolis for his care. There was no care closer. I don't know if you know the Trimbles. When they had their health issues, they had to be placed in Bloomington, which is not only, I mean, like my friend, not only does he go a long distance to visit, but they're still making healthcare decisions for his son. So he's got to be there to see the condition and talk with staff. So it's a real issue, and we know from Champaign County Healthcare Consumers that they had a big concern as they're trying to place people from university rehab, and they had to place them in various places outside of the county, as well as there is a little bit in the county. There's a home in Gifford, and there's one, actually it's in Ford County. There's one in Gifford, but it is also full because it isn't a one-star rated home, it's a higher rated home than that. So we're concerned about the shortage of long-term care. Our little group is now, just by talking about it, we now have 80 people who have signed our position paper that says we think we need to come together as a community to do something about this. We're not suggesting we have a solution. We're suggesting that what we need to do is do a need assessment and a little bit of a study on looking at what else is being done in our country, and see if we can come up with a solution for our community. We are asking, we're going to go to the county board, and we've communicated this to many county board members. We're going to go to the county board on June 22nd, public participation, and present essentially our position paper. And we know that this is an issue not only for people our age or disabled, but also it's an issue for the hospitals. The hospitals have to discharge patients somewhere. If those patients can't be someplace that is accessible to their doctor, and maybe they can get the support, there's the increased risk of those patients being readmitted to the hospital, which the hospital gets no money then when those patients are readmitted and takes care of them. Or the other thing hospitals have been running into is they keep people in the hospital for much longer than is needed because they have no place to put them. So it's a problem for people, it's a problem for hospitals. We're asking the county not to get involved in the nursing home business. Can't say clearly enough, we don't want them to own a nursing home, we don't want them to run a nursing home, we don't want them to be involved in the nursing home business. We would like to see if they could preserve the existing university rehab facility and just see if they can create a delay in the sale of it to anything other than a long-term care facility. They had a contingency when they sold it. It had to operate as a long-term care facility. I think it was for 10 years. Of course, you can't make somebody operate a business if they can't do it, but you can maybe prevent it being sold to anybody else who's not going to provide long-term care. And that's what we're asking to do. I don't know that that's the facility we want to be in, but as we were talking about today, it's a nice facility, and we at least like them to preserve it until we can figure out what we do need to do. So we're asking the county to see if they can delay the sale. We're asking the county to see if they would name somebody who could join a community effort, look at solutions, and we're asking the county to look at funding needs assessment. And we're really talking to Julie today about the possibility of public health doing the needs assessment. She suggested maybe in combination with regional planning. We just think it needs to be done by somebody who knows how to do needs assessment, somebody who's removed from the county board or our group or something.
So not us. I thought that was a natural thing for a county board of health to do.
I think it's a natural thing for the county board. Well, I would be delighted to have the county board of health say, yes, we want to do that study. We look for funding for it, and one of your staff people suggested it's mostly time, somebody's time and mileage and a few other things. So we're looking at what might it cost. It might cost $40,000 to $50,000. So we're looking for some funding for that. And this is not in our position paper, a little bit off topic. If some of you will remember that in 2002 there was a referendum passed in the county for a 3-cent levy for taxes for a nursing home. That levy, that continues to be levied. The funds right now are being used to pay back the county for the loans that they made in the nursing home when it was running into problems, when the state of Illinois would not give them Medicaid reimbursement. My understanding from one county person I talked to is that that will be paid off by 2025. And when we talked to the county, they said there is no nursing home tax anymore because it's been incorporated into general funds. So it's not being used for nursing homes, it's being used to pay off, and it's being used for other things in the general fund. But from my perspective, that means there might be some money there, which was originally intended for a nursing home, but maybe we could get $50,000 out of it to help fund the study. And maybe ultimately help fund a broker to help us identify some good owners and operators, people who we know run 3 or 4 star facilities rather than 1 or 2 star facilities.
Can you talk about the county board, sense of what the county board is up to with this?
Yeah, without trying to say too much there, I know because we're still getting into litigation, but I think there's a pretty healthy desire now with the board. If you watched any of the board meetings when Abby Cronley came or when he sent his subordinates, they got beat up pretty badly by me and several other people. But that was mostly just out of frustration. There's not really much we can do in terms of stopping them from closing. They're going to eat the penalties that are involved with closing a nursing home and all of that, and just chalk it all up to a loss. Public awareness of the fact that they bought 3 nursing homes and this is the 3rd one they're closing, obviously, but none of that really matters in terms of like they've done the damage that they can do here. It might spare somebody else, but I remember when we were going through all this, I was trying to get on the board at the time when the sale was kind of coming around, and there were other counties that were coming here and saying like, this is what they did to our county, you shouldn't let them do this, and they still voted to do it anyway. So I think there's a healthy desire amongst the majority of the board members to do whatever we can to. I mean, we can't really stop them from closing it, but obviously they came with this what they were considering. They were telling us it was an olive branch. Well, we found this other company that wants to take it over as a drug rehab facility, and we just need you to change the covenants that you put in. And obviously, we're not willing to do that, and I believe that would continue. I don't think anybody has any. I mean, there was the thought that like, well, if we can't find anybody to use it for what's being currently used for down the road, maybe we could change that without doing it to help them in some way. But right now, I think the pause that we can put on is to continue to enforce the covenants. And I think, when Lynn sent I've got the position paper open, which is great. I think everybody was kind of the same mind that like this is a good idea. I don't know about the funding, and I would be happy to try to figure out whether or not on the county board side we can do that. I don't think there's anything that we can do to stop whatever the Rockers are going to do. Like they're doing their thing, right? Beyond that, I believe there's a pretty healthy desire amongst board members to try to. I mean, like that was one of the main topics was number of beds and how many just that one company has removed from this community. And Stephanie Furtado had a very, very good run at like she had pulled all the numbers because she's really good at that. She pulled all the numbers and said like all these other nursing homes around here are at census that they were at pre-COVID. You're saying that you're having these problems it's because you're creating the problems. Like literally, if you just did these couple of things that these other homes are doing, you'd be back into that number. You just don't want to. So I think there's a pretty obvious ability for us to put that home somehow into the hands of somebody who would operate it better and actually see the census go back up.
If the deficit is what you're describing, 300 beds once these guys leave, you just assume they not stay because for this to work well, you'd like it to be an effective business operation. And I look at 300 beds as an opportunity, not as a problem. And then my next thought is there are a number of nursing homes that are operating here and operating well. I'm wondering if there's an opportunity to go to your existing population of nursing homes and say, well, would you like to expand your operation or at least take on the responsibility of doing this because you're here for a reason. So the Villas of Hollybrook and the others that I think are perceived as good, would they perhaps take on 300 beds is an opportunity. Then, not to operate a nursing home, but maybe the county board could provide incentives, to leverage the existing nursing homes that we have here now, where they might come over and be an operator, not an owner, for a period of time, and the upfront costs that are whatever you incur when you do that kind of thing, maybe they could be funded. My main point is just that 300 beds is a business opportunity, and someone who sees it that way, that's who we want, because they'll do it right. So, I get it from I'm a lawyer, I do estate planning, I'm getting it from that, and I'm hearing this whole powers of attorney and guardianship issues, and what am I gonna do now? And then there's the calls from the social worker at the hospital who has to discharge somebody, and then I get the call from the client, and they're telling us we have to, and then people who are there for 2 weeks instead of 2 days, it's real.
They can't discharge to the street.
Yeah.
And if you have somebody that needs skilled nursing care, they have to stay there until they can get them in the skilled nursing care. I told Kathy at our meeting today that I know a family whose son had to go, who's completely out of the county. And it's a hardship on families, a lot of families to have to go see their family members out of the country.
What you were talking about with the, I remember the 3% referendum, that's been folded into the general operating fund. That could be challenged in some sense, but not.
It could not, they got an opinion there, and they cited the opinion to us at PTEL or something like that, that it's a legal thing to do. So, I think, honestly, as a taxpayer, you sort of say, wait a minute, we want it to be used for nursing home care. But what they've done is perfectly legal. So if you challenge it, you probably lose, and you don't fight for nothing.
But I think a public opinion challenge could be
I think that would be
a very persuasive. I would say that a preponderance of the board members are already that point was literally made by some board members during this whole thing.
Was it?
And so I think, I think with a little bit of nudging or just honestly awareness, because not every board member, was there for all those discussions, but I think that can pretty easily sway to say like, okay, we're doing this the legal way, but we probably should, in good faith, try to put some of this towards. I don't think that would be very.
And our group went through exactly this discussion you're doing, and we said, look, we want to partner with the county board, and actually with what we really want to do is the same kind of thing Julie and I were talking about today that was done for COVID. And really we did the same thing when Francis Nelson was itty bitty. Carl, OSF, Christie, Public Health, United Way, all got together to say, what can we do? Because as I was telling Julie the story today, when I was involved with the county nursing home, I went to Carl and OSF and said, what are your needs? And can we arrange some kind of agreement so that we can take your patients? And they said, look, we need bariatric care, we need somebody to do complex care, and we need somebody for our COPD patients, because most long-term care doesn't have enough oxygen for our COPD patients. And we said, as a not-for-profit, would you invest in this? Buying some equipment, maybe helping staff some, and they said yes, because it would help us so much with our patients. But we were right at that moment, and the county board really was also at the moment where they said, we just want to get out of this business. But it lets me know that there's an opportunity and there's some interest from some other players. So if we could do the same, take the same, to take your say, where we bring everybody together to say what is the real need and what's the best solution. And maybe the best solution isn't that we need 300 long-term care beds. Maybe it's that we need 150 long-term care beds, and we need some assisted living, and we need some daycare, and we need some respite care.
Were you, when you were working back earlier in your life, were you involved with RHRC, Regional Health Resource Center?
Yes.
This is exactly what, only it was different reasons, but it's a combination of all the healthcare providers in our firm started it, but it was Ben Williams who was one of the people who was in charge there. They brought all the people who normally compete with one another, the Christies and the Charles, and talked about these kinds of things and figured out where there was common.
That's right.
That's the kind of group that we need.
Right, that's exactly the kind of group. And I'm meeting with Jim Leonard from Carl to talk about it. He was very receptive that we're trying to get set up with OSF. But I think that's I think that's what we need to do, is to get everybody
So
together.
what role could we play as a county board of health?
Well-
If any, specifically, what could we do?
I think, in the first place, it's a county issue, so it does seem like it should be something that we would be involved in. I'm kind of open to the role. At the very least, it would be nice for the county board to say, this is something we support. If the county board of health could say, yes, we'll help convene this group so that you give the authority to, it's not just, again, four old ladies sitting around coming up with this idea, but there's an entity that says, we would like to organize this group, we'll let you meet in our place or something like that. I mean, I don't think it has to be staffed, I don't think it has to be a financial commitment, but it could be what's the word, morale commitment, I can't think
Yeah,
of
I
just
mean,
a.
sign on to the letter. Well, this is something that, or just sign on to the letter, or, have somebody speak at the county board meeting and say, the county board of health supports this proposal, or you can just sign on to it. But what you're talking about, what you were talking about earlier, and what Kathy and I were talking about today, is basically like a community health strategist position, which is what public health does. We did, like you said, we did it for COVID, we did it done it for other things in the past, but to convene everyone and start doing that as systematic, you do the needs assessment, then you figure out what is out there, what's needed, and then get everybody at the table who can make the decisions and get them to start making decisions. And it has to be a high level thing, because it has to be the people who can make the decisions. It doesn't do any good to, and it can be done.
That's the reason we have a blood bank.
Right, that's the reason we have a
That's how
budget.
it started, is you
Exactly.
got all the people who needed to use it, and they were all competing with one another, and so you put them in the same room.
Yep.
Figured it out.
That's why we have
And you
Francis
figure-
Nelson Health Center out on Bloomington Road instead of on Carver. I mean, it just, the hospitals came together, and the clinics, and said, we really need this, and they all divvied up something.
So you'd want to identify the stakeholders.
Right.
It might be a little bit different.
That's right.
And
then
I sent you
pull-
did you see what I sent you today?
No,
Or-
yeah, okay.
I sent it after our meeting, but like the list of the people that need to be there. There are the money people, there are the planning people. The planning people are public health, probably Champaign Home Care, consumers, regional planning for sure. And then you have the money people, because that's probably not going to be us. That's going to be Carl, Christie, mostly the hospitals and the insurance companies. Christie,
Insurance companies too, that's
and,
right.
and the insurance companies, because they all have a benefit in this working.
How about the existing nursing homes?
They're another group as well, yes, bring them together too. But the problem, a lot of times with the existing nursing homes that we have here, what you're dealing with is, not always, but you're dealing with managers as opposed to who makes the actual decisions, but they have to be involved too. Because some of them could make decisions that, otherwise they're just kind of stuck.
One contribution would be to put a person, you try to get the owner there, I mean, actually.
Yeah, get them there and just say, hey, we're looking at this. But I have always lamented the fact that I thought that the county nursing home, when it was first built, and after no problem, was really, that was such a lost opportunity in this county, and is such a, to have a county supported, financially supported. It could have been financially supported without being micromanaged. That was where the problem came in, I think. And to make it be, people need to make their place the place to go and the place to work. If you don't have, having just dealt with, the best place in the county, if you don't have people working there, if you don't have good people working there, and what.
It used to be the best.
It was considered the best.
It was.
Yeah.
It is, well, again, it gets down to who's working there and what you can get. And the thing is, if it's all about, it's just what we need for any of the caring professions, but especially people that work with vulnerable. Those need to be good paying jobs, period. They need to be good paying jobs, and they need to have benefits so that the person has one job, because it is a public health freaking nightmare when we have an outbreak, because the person works here for 4 hours, they get a 4-hour shift here, and then they have to go over here for a 4-hour shift, and then if they want to eat, then they need to go ahead and work at the nights or the weekends at somebody's house, and it is hellish, and people burn out in that type of
of situation. They need to be good jobs, and that's where I thought the county really, could have done that. It could have been the place to work, set the standard, the place to work and the place to go. And do some really innovative programs. And then you bring in the other places with the different money to help out with. So that it's not, the county shouldn't have to be supported, and even a county nursing home should not be supported. In my opinion, a county nursing home should always be the best because it has more opportunities for funding. You have your Medicaid, you have your private insurance, you have your, fundraising, you have your tax levy, you have your, hospitals when you put into it, but.
It is, there's no doubt about it, in Illinois, it is a tough business to run. I mean, Illinois' Medicaid reimbursement is, 49th worst in the country, I think. And so it is a very tough business. One of the companies I consulted with for 2 years, the nice nursing home company in Bloomington, Heritage Enterprises, they've just gotten out of the business because it's such a tough business right now, both the Medicaid and Medicare Advantage. When we talked with Deborah Reardons from Clark Lindsay, I said, why are you downsizing this much? And she said, Medicare Advantage has really changed the picture because where it used to be discharged from the hospital, somebody come in for 4 to 6 weeks during recovery, now Medicare Advantage is saying 2 weeks, 2 weeks. So that's exactly what I experienced with my husband. After 2 weeks, they said, you need to go you're out. And so she said that the trouble is those 2 weeks, it's really consolidated expenses. And in her situation, Clark Lindsay, even though they don't take any Medicaid patients, they weren't getting reimbursed enough so that the people who live at Clark Lindsay were subsidizing the operation of the nursing home. And she said, we can't do that for the community. But our community is unique in that here we are at a 40% deficit when the state overall is at a 17% excess of beds. So there, part of that is because it's just what you said. We had a big player come in and he took out a whole bunch of beds. Now the good news about that is when we looked at this before, when we were selling, I talked to a couple owners at that time. They said, we don't want to be there because it's a public entity. We don't want to have public board meetings. That's not the way we run our business. Frankly, they were concerned about being involved with union employment because healthcare is worried about union employees, and there was too much competition in town at that point. All of those factors are gone. So I think we might be a more attractive community for a good provider.
We're really going to go 300 beds down. You just wait because you sent a lot of families out to Chicago or Peoria and all of a sudden.
Somebody's going to say, oh, maybe there's a market there. That's right. And we have, if we could do this, then that would give us time to look for some good providers. Now, just a little warning on what you said, the other people in town like Reflections and others, those are not skilled nursing facilities. The only skilled nursing facility we have are Illini Heritage.
I have a mother and a mother-in-law, both in Reflections. So
Which is,
when I go there, I get to visit both.
Yeah, and those are.
They're not skilled nursing.
No,
That's right.
the skilled nursing is what's missing, and the skilled nursing is what the hospitals are gonna want to put in.
Right.
But that's not where the building is going, and that's not where all the expansion's going, because that's not as profitable. But it's
So these
super
memory care
important.
units are not skilled?
No, not at
None
all.
of them are. The
Not at
only
all.
skilled
And they're less
nursing is
expensive,
Illini
too.
Heritage,
They're-
Senior Rehab,
And then you
Clark
get,
Lindsay. Only three
they're
places.
safe, they're great, they're needed, God
Right.
knows they're
They work
needed.
with dementia patients.
But eventually,
They'll kick you out.
That's right.
eventually you'll get to
My
where you
mom
can't
will
do
get
anything.
kicked out.
And then where are they going to go?
Right, that's exactly the issue. And if you, right, yeah, where they can.
I don't think people understand that, because I've had so many people tell me, oh, we have, Savoy is basically a giant nursing home. No, it's not actually. It's there, we have a lot of, and needed assisted living, we have a lot of memory care, we have a lot of that type of thing. But we do not have, and don't forget the Inman is no longer,
Right.
and that was an assisted, basically an assisted living. They got meals, they got, you gotta go.
I don't think now, I'll make it to the county board meeting.
Oh, no.
Oh, okay.
Okay. Thank you.
Thanks
for
We'll
giving us
pinch
your
it on
input.
the missing thing.
Do you have
So I can
anything,
eat.
anything else you want to tell us about from the board's perspective on this?
No, I'll have a better idea because we're gonna talk about it a little bit tonight, although they probably talked about it in Congress, but it's okay. But I wanted to kind of hear everybody on this side's take as well, so I'll get a little bit of an idea and I owe them a call back anyway, so.
Good. Right, if you have run it by
Thank you
me
very
and pass it
much.
along.
Awesome, thanks so much.
Thank
We
you.
can see y'all later.
Bigger strategy, like, there's a specific resolution we could adopt or a letter.
I think her
Get us
point's
there.
on that. She, in your, you want me to go get your letter? Okay,
Yeah, I'm
because
so
in her
sorry.
letter, she
Well-
has like just specific things, like don't sell, or don't sell right.
We won't be able to take any action
Oh,
because it's
right,
not on our
that's right,
agenda.
right.
So we
You
wouldn't
should
be able
put
to
it on
sign
an email.
anything
Put
or
it on
sign
an
anything.
Okay, we'll send
Put
the
it on.
email.
Yeah.
Yeah.
Because I think if we, well, no, you're right, it can't be done.
But we can't next meeting, so.
Correct.
Yeah.
We could put it on the August, that's what I was gonna mention, put it on the August. We can see what Mike and the county board is able to do when you come in June and what they allocate. So if they allocate the funds for the needs assessment and want participation from the Board of Health involved in that and the convening that's being talked about, then they can provide the direction back to us on what they would like to see us do there. In the meantime, we could put it on our agenda for the August meeting, and then if you have the resolution or document that you want to present at that time, we can put it on as an action item, and then we can vote on that to provide the supportive piece, which may be retroactive because they may already decide in June to go ahead and give you the money, or at the next meeting, excuse me, my apologies, at the next meeting to give the funds to allocate for that. But I do think David has an excellent point too, is bringing in those other nursing homes because of the business opportunity for expansion and working with the existing structure of the people who are already dedicated to this community would be a certainly advantageous way to move forward, because we never know whom you get from the outside if unfortunately they might do the same thing that's happened in this last instance, and you know.
I'd love Gifford to open up a big one here in Champaign-Urbana.
Well,
Yeah, like people love different.
Yeah.
and
That's
Gifford is
small
managed
town, though.
by Heritage Enterprises now, I think they're just about to get
Call-
out of that. But,
Call it a public-private partnership, which I would say.
Right.
So it's not the county board running the nursing home by
right,
itself.
we do not want the
But
county
you
board.
you let those publics, they be a for-profit group, take the risk and get the upside, and we give them incentives.
Well, but what's gonna happen, because it's my understanding that the county does not own that anymore. They just have, the only thing
They
they
have
have is a
nothing to do
covenant
with
that
it,
says you
They don't
cannot.
own the facility.
No,
They
no,
sold
they
it
sold
already,
it to
and
Avi
this
Bruckner.
people
He
ran
owns
into the
it.
ground. And so what happens now is that the only thing they can't, he already closed it, can't prevent him from doing that, but they can prevent them from selling it to something other than long-term care.
What, up till 2028 or what?
I think
Or until they sue them so
But
bad.
I'm
that
not
they
tying my
just-
suggestion to that building. I'm saying
Oh,
county involvement in providing incentives to top
To somebody.
quality.
oh, I see what
nursing
you're saying.
home.
Oh, I.
They may decide to go to that building and negotiate, but they, I'm saying anywhere around. We know the need is there.
That's right, we do. And the only sort of caveat I'll give to working with the existing actual long-term care facilities, and remember that they are both one-star facilities. You don't want to duplicate what they're doing. If they were stellar, if I could get Clark Lindsay to say, in fact, I said to Deb Rivers, any chance you guys would want to do this someplace
So who
else?
are our long-term care nursing homes?
Our nursing homes are Atlanta Heritage and CU Rehab, that's it.
That's it.
That's it, that's it, and Clark Lindsay. And those two are both one-star facilities, so we don't want them, that'd be a little bit like having Avi Proctor
What
back.
about asking assisted living type places if they want to
If they're
expand their
interested in
operation?
that, I think that would
That's a
be a
new
reason,
area.
that's right.
But if we gave them some incentive.
That's right, and they might be
That
interested.
would be wonderful if all of them, because all of them are eventually going
Yeah.
to need that.
So
And
add
keep in
nursing
mind that
home.
OSF runs some owns and
Well,
operates
that
some
opens it
long-term
up
care.
to all the, like Bill's, all that broken.
Right, right, that's right. I think any of those
Great wins.
And there are also some, not many, but there are a few good for-profit operators. Not lots, and not lots in Illinois, because it's such a tough environment, but there are a couple. There are some good not-for-profit operators. Many of them are church-related. I mean, Apostolic runs
Yeah.
lovely nursing homes throughout the downstate area, but I don't know that they'd be interested in this. The advantage of it being a not-for-profit would be, it'd be easier for people like OSF and Carl to invest in it. They can't invest in a for-profit entity. Now, they could rent some space from the for-profit entity. I don't want to get into the solutions here, but.
OSF.
Use the RHRC model, because.
Yes, that's right.
They bought into it, they figured out a way for.
That's right.
Or at least, that's They're mostly the living.
They are, right, I don't
They
know
used
that
to
they're
meet and
any.
talk about all kinds of stuff.
But we can still follow that model, that's
Yeah,
the
model.
same thing, right?
I got all the bylaws.
I'm a little concerned that we're getting
Because
into
my dad did.
big areas that certainly weren't on the agenda. We have a lot of discussion, maybe we should put this on the agenda
Oh, I
for
agree.
next time and
Yeah.
just have some expanded.
I think that's a good idea, yes,
Yeah, we
thank
don't,
you.
I mean, we're
Right.
seeing a lot of stuff, and so,
I agree.
you know, I think we're on the same page, but we probably should just put it on the agenda, and then we can have a way before we sort of address it. So I'm just taking this as formal background and interest, but not have some official stuff that we're talking about.
But if anybody who's here would like to come to the June 22nd meeting and say, I'm from the Board of Health, and I think this is a good idea as an individual, that'd be great. I think the more we can
I
show
don't know why I'm
strength.
thinking it's May.
I almost said July
I
2nd.
just keep
haven't done
thinking
my
it's
calendar
May.
yet.
You think it's May?
I don't know why.
We're past May.
Because you went through COVID and you have no sense of time.
I know, I said County probably 3 times today,
Thank you, everyone. Our next meeting is Tuesday, August 22nd at 5 o'clock. That will be a long meeting, that is the budget meeting. So that meeting is typically a couple hours just with the budget items. If we add this additional item, I'm just putting it out there so everyone's aware it will be a long meeting.
This is the kind of thing we can set a session. I mean, maybe.
Yeah, we can certainly do that. And again, we'll get direction from the county board between now and then, so, you know, it may be that they say, don't put it onto the agenda item, do a special study session, or you've gotten the money and we need to go ahead, you know, do the needs assessment, it becomes an update rather than an action piece or anything. So we'll, you know, I'm sure Kathy will keep us informed as well as Julie, on what they say, so we know exactly how to
That is my
budget.
first day on for 3 weeks.
Okay, so that's too bad. Thank you.
Thank you. So having entertain a motion to adjourn?
I have a meeting in
Moved by Lyndon, do I have a second?
network.
Second by Dr. Verweiss. All those in favor? Aye. Anyone opposed? No abstentions.
Thank you for the time, thanks for letting us take it.
We didn't touch on the issue of
Oh, yes, thank you so much. We voted previous to continue the present slate, the